Hey guys, I thought I'd do a video on my experience with methotrexate today. So basically, it comes in a box like this, and you get, I think there was like 3 or maybe more of these vials. The medication's yellow, like this really bright yellow. You just take this off and go in with the syringe. I don't think, judging by the amount that's in here, especially, yeah, there's no way that this is a single use vial. I think if I remember correctly, this was more than one use. You would just take an alcohol pad and clean this part off and clean wherever you're going to inject. I don't remember exactly where the injection sites were. I know it's different than like Benlysta, I think. Anyway, so I had to try this drug because I'm ANA negative, and in order for them to justify giving me the lupus specific drugs, I mean, really, there's only 2, Sefnilo and Benlysta, that I'm aware of. I know there's some clinical studies that are about to go on or currently going on. I think they're currently going on. Anyhow, regardless. So sometimes if they're not sure exactly what autoimmune disease you have, like RA or lupus or whatever the case is, they'll try different medications. For me, they weren't sure if it was RA or lupus, and with the ANA being negative, I could do a whole other video on this, but it's harder to get the lupus specific drugs when your ANA is negative. So this is why I had to try methotrexate. It is a straight up chemotherapy drug. This is given to cancer patients. I'm going to guess in much higher doses, probably than we're getting, which I honestly cannot imagine. I could be wrong about that, but I know that's the case with anti-rejection drugs. Usually we're given anti-rejection drugs, but in a lower dose than someone that has a donor organ would get, right? So I did not have a good experience with this. Within an hour, I was vomiting. I could not stop throwing up, like violently vomiting. It was just nasty. And from that point, I became extremely exhausted. I could not get out of bed, and I had to take 2 Medrol dose packs. This went on for like a month and a half. It took forever. I could not get out of bed. I was so weak and exhausted. So, sometimes, especially if you're ANA negative, these insurance companies will want you to try A, B, and C before they'll let you try this other drug that your doctor probably already wanted you to try and had already talked to you about, which is exactly what happened to me, and it happens to a lot of people. But he knew that with a negative ANA for Benlysta, they weren't going to, or weren't likely to, approve it unless I tried a few other medications first. So basically, I had to go through a month and a half of misery because of this. I can't stand that insurance companies do this to people. I feel like if your physician feels that you should have a drug, I don't think insurance companies should be pulling this level of fuckery. I don't understand why they think they know better than the doctors what's best for the patient. I will never understand this. Anyway, I'm ranting. I'm sorry. But yeah, I did not have a good experience with it, and I had an adverse reaction, obviously, but it lasted weeks, and I just was in bed for weeks and felt like it was never going to end. I mean, after 2 rounds of steroids, it started to get better, but I lost a job over it, actually, because no employer is going to be like, oh, yeah, you can just not come to work for a month and a half, you know? So there's that. This was a while ago, and although that sucked, it did lead to me taking Benlysta, and then Benlysta worked really well. I did that adverse reaction, and that's a whole nother story, but I'm now back on the Benlysta, and I wouldn't be at this point if I hadn't gone through that, unfortunately. So these are just things that we go through and that we have no control over. We're at the mercy of these doctors and these insurance companies, and sometimes, especially if you're antibody negative, that becomes a problem too, because, you know, you can imagine that it's certainly better to take a lupus specific drug than it is a straight up chemo med. I mean, so if you're a friend or family member of someone that has this disease and you're trying to understand what we go through, I really appreciate, we all appreciate when our family and friends try to educate themselves. And these are things we just go through, and we have to go through the motions, you know, and these nasty side effects and all these things until they figure out what medication works for them. I've been going through it for over 6 years. And I've lost that much of my life. I've lost jobs. I've lost relationships. I've lost my independence. So many things that I'm just now starting to get back. Very slowly. Painfully slowly. So, you know, these are years of our life we'll never get back. Money will never be able to make back. It's just, we lose a lot in situations like this. And it's very hard for people around us, I feel like, to understand, because they don't see, a lot of people don't see this side of what we go through. So I hope this helps somebody. I would not, because I've talked to people that have cancer and they take the methotrexate, and some people are fine. They don't have any adverse reaction. But I've talked to a number of people that have. I just think that if they're telling you that you need to try this first, and that's going to lead you to another option like Benlysta, if you're in a similar situation to the one I was in for whatever reason, this is just part of what you have to go through. I hope that this process changes, because it is ridiculous, and I understand that, and I know you're probably mad and frustrated and just sick and tired of this, but this is just what we go through. You have to be patient. There's nothing else really, nothing I'm going to say is going to make it better for you. You know, just do it, get it over with, and hopefully move on to something that works. Seriously, that's the only thing you can do. And if you procrastinate or whatever, you're just prolonging your own suffering. You know what I'm saying? So just do what you gotta do. Buck up, buttercup. It'll be alright. Stay strong, guys.